This is Dr. John Wycoff. Welcome to Pathway to Wellness with Dr. John Wycoff. We have a podcast that centers on natural solutions for chronic health issues. And today we're joined by a colleague, a mentor, an author, and a friend. That's Dr. Tsu-Tsair Chi. Dr. Chi resides in Anaheim, California, but travels the world evaluating patients and teaching clinicians about the ancient Chinese art of fingernail and tongue analysis. So welcome, Dr. Chi. Welcome to Pathways to Wellness.
Thank you so much, John.
It's a privilege to have you, and we've been friends a long time, and we have the privilege of having you in Michigan many times, and we're going to repeat that again September 8th to 11th this year, 2025, with individual patient clinic evaluation and a seminar on September 9th at 6 p.m. So I thought today we could just talk a little bit about, your approach to fingernail and tongue analysis, how you evaluate a patient, and what some of those common changes that you see can help a patient understand what's going on with their health, not only today, but maybe more importantly, what health issues should be on their radar in the future. So, Dr. Chi, I know you've got some pictures to share with us and information, so I'll let you take the floor and lead us forward.
Yeah, so this is a nail. Each hand, 5 fingers, and normally we should have 4 fingernail from the thumb to the ring finger should have a half moon. The thumb half moon should be 2 years old, should have this one. The index 4 years old, and the middle finger 9 years old, and the ring finger 14 years old. If this half moon don't come or delayed, means your circulation is not good. And also for the children, concentration in the school is not good. And that means eventually maybe have a circulation problem, and of course, and their chance to get cancer also may be higher.
And that's an easy thing for people to look at. They can look at the half moon at the base of the finger, the thumb, the index finger, middle finger, little finger, the ring finger, not on the little finger, the pinky, but indicative of poor circulation and lack of oxygen getting to the mitochondria to make energy. So fatigue is going to be a symptom. So that's a quick, easy thing that people can look at the 8 lunulae at the base of their fingers.
From there, we may be also thinking, we can bring back is Fingernail or asparagus or ox power. The asparagus is very good for MTHFR gene mutation people. So that's also one factor for 40% of Americans may have MTHFR gene mutation. You can see that.
That's a good point. I think that's a more common recognized issue is these genetic methylation barriers, and MTHFR does affect over 40% of the population. So asparagus extract would be a good choice for someone like that.
Yeah, use Fingernail can be circulation using. It's very good. Before you go into use a blood thinner, you can try use Fingernail. And ox power is very good. They can make your CRP go down. CRP means inflammation. Inflammation is excellent, important. If you don't make CRP go down, then many years ago, have lots of problems, not only stroke, heart problem, lung problem, even cancer.
Well, let's move on to another part of your evaluation.
Okay, we're talking carving nail. When we see the people nail tip go under, then that's 60% related lung disease and heart problem. These two. And 20% related cancer, and special lung cancer and lymphoma. And autoimmune disease can be less than 10% and parasite 5%. So this is a very important sign to look in the nail go under or not.
So there you're looking at the curvature of the nail, between the top of the nail and the tip of the nail. And if there's that rounding where the nail should be flat, that's what we call clubbing.
And this is very important. We don't want to eventually you get a lung problem or even lung cancer patient showing this kind of sign.
So if someone has got clubbing of their nails, what natural things would you do to recommend to maybe improve their oxygenation or their lung issues?
Yeah, I will give Oxy Power. They will improve lung function. And also if you have a little with the heart problem, we will give you the Fingernail also. The lung and the Oxy Power and the Fingernail, excellent for also this kind of disease.
And when we talk about these products, these are products that are produced by Chi Health that are natural. Most of them are herbal Chinese herbs that you developed and that you market. Is that correct?
Yeah, like Oxy Power is a Tibet medicine. It's 4,000 meters above the sea level. And even animal will eat those kind of fruits to make them in the high altitude doing well. So this is only I have this kind of products.
Excellent. Okay, excellent. Let's move on to another slide.
Okay. This is very important. When you see the tongue, if you see any kind of strawberry dots, that's very important. That is a hormone imbalance. We see these dots, if they're already past the teenager, still have these dots, then for women, girls, may chance go to endometriosis, ovarian cyst, and eventually uterine fibroids, hormone problem. But later on, even in 30s, the chance get a thyroid cancer, breast cancer, ovarian cancer chance, very, very high. So we always want to see this kind of tongue. We need to balance their hormone. The most important, we need to balance their progesterone estradiol ratio. Okay, so progesterone estradiol ratio, if under 100, is very bad. So over 200. This is, you can see the clinical sign and also look at your blood work. See that?
Yeah, certainly a very common, especially in women that are over 30 or 35 years of age, and it gets worse as they get closer to menopause, perimenopausal years, and women start having hot flashes and night sweats, and they have irritability and insomnia, and their joints hurt and brain fog, and they start gaining weight, especially around their belly, just below their umbilicus, their belly button. They'll start having that little roll, which they just hate, and oftentimes that relates to estrogen dominance. So getting those hormones balanced, I know that we often recommend the supplement Myomin for estrogen dominance. You want to talk a little bit about that, Dr. Chi?
Yes, Myomin. Since 30 years ago, we studied the market, and we found out that this is an aromatase inhibitor. So very famous hormone doctor, Jonathan Wright, always in the bioidentical class, BHRT class, hormone class, teaching how people use these products. So for men, we can easily lose belly fats and then make your testosterone up, estradiol go down, and also make your the PSA, if they're not a cancer, they can go down. Very good. And spatial, if any man take the 5-alpha reductase, like a Propecia, finasteride, those kind of drugs, you have to use Myomin together. Dr. Wright always say, if you take those drugs without block the aromatase, then your chance get a cancer, and the cancer go to the bone, very high chance. For the woman, if we have a hormone imbalance, we talk the hormone imbalance is not talking for total hormone. It's talking progesterone estradiol ratio, and the estrogen have an E1, E2, E3. So if E1 is much less than E2, E3 together, also trouble. So this balance is use myomine, they do very well. So many people, even they have cancer, they cannot use the aromatase inhibitor, or they cannot use those kind of AI drugs. You can use myomine together, you do better. Then,
excellent. Let's move on to the next marker that you can look at.
Then you can see this is men have prostate problems, see the dots. So they also have the showing, of course, this tongue showing the teeth mark and the crack in the center. But in this show, I especially talking those strawberry dots. Okay, then when I see this kind of people, when they are in the younger time, I also ask they check testicle, and for close to 40, I was studying check the prostate, and the PSA number. You don't want to waiting for 4. They really relate to age, like a European standard. 2013, they all changed to European standard in all Europe. That means if you're 50 years old, your PSA should not over 0.6A. So that's an important point. So looking for that.
So I think we oftentimes think of hormones as being a female issue, but really hormones are ubiquitous. This is a male and female issue. So even our male listeners should be in tune with, getting the correct testing done, asking for a testosterone level, asking for an estradiol level, and a PSA to really get a full hormone evaluation, determine what you can do for optimal health. And something like myomine may help restore that balance for both men and women. The strawberry dots on the tongue may be a harbinger of hormonal imbalance. All right, Dr. Chi, let's move on to the next marker.
If the men have this one, if you also look at your P should be one straight line. If they split, then that means your prostate enlarged. They block the P, then always have residue in the bladder. That means causing infection. I will give a kidney Chi to clean them that. Yes.
Excellent. So the urinary stream can be another indicator that prostate is enlarging and suffering some of the effects of too much estrogen. All right. Very good, Dr. Chi. What's next?
Okay. Look at, if you see skin have red dots, always remember that's hormone imbalance, hormone trouble, or estrogen dominant, especially in the breast. Okay. So in the breast, if your breast have these red dots, with the fibrocystic breast or special dense breast, you better quickly prevention, because you need to prevent even before X-ray mammogram can see, because mammogram can see should take at least the tumor already 2 to 3 millimeter. But by this sign, you can start in prevention. Don't let them grow. Okay, this is a very important early stage. I wanted everybody to understand that.
And that's something everyone can look at. They can look at their abdomen, look at their chest, their breast tissue, and if they have these little red spots, they're like a burgundy spot, dark red. We call them cherry angiomas, and you can count them. If you've got more than a handful, then that's really significant and relates to estrogen dominance and an estrogen metabolism issue. All right, Dr. Chi, again, myomine would be a good option. There's a bunch on the abdomen there.
I want to talk to the men. If men have these red dots, usually first thing I will ask them to check a PSA. This is when you check PSA, you also check a testosterone over E2 estradiol ratio. If any time testosterone over E2 ratio, it should be over 20. If under 10, a trouble. Okay, so quickly use myomine and maybe other herbs. Okay, prostate Chi or even angel stop to do, and this is very, very true. For men.
Excellent. Yeah, you're right. This is just as much of an issue for a male as for a woman, is looking at these cherry angiomas and understanding hormonal pathways of detoxification and why they don't work well. Some of that can be related to that gene we talked about, MTHFR, other methylation genes, but these are natural ways to help get your metabolism back on track. Okay, Dr. Chi, what's next on our list here?
Okay, then we're talking in the center of the tongue. We don't want the line, special deep cracking, like this one, deep cracking is more than stomach, it's stomach ulcer or duodenal ulcer. So this is very important. We don't want the cracking in the center, okay? And the deep, if the deep more than 2 millimeter, I will give them digestron. Digestron is make your body produce your own enzyme. It's not a digestive enzyme. Because if you always use digestive enzyme, then your body, your pancreas, and your stomach will be lazy. They don't produce your own enzyme. I like use some herbs, make your body can produce your own enzyme. That's really good. Yes.
So that deep crack in the center of the tongue is not normal. Here again, our listeners can look at the mirror, stick out their tongue, and the tongue should be flat across both sides. There should not be little cherry dots or strawberry dots on the side of the tongue, and there shouldn't be indentations around the edge of the tongue. Those are abnormal findings, but that deep crease, as you see in the center of the tongue, like on this slide, indicative of stomach issues, maybe an ulcer, and there may be natural solutions like digestron or GI Chi that can help you with those symptoms. So another easy thing for people to see, right, Dr. Chi?
Yes, and also the tongue's coating, very important. The coating, if you become very thick white, that means serious. So really the tongue's coating also means something. But today, if you guys interested, come to see me, I will explain to you more.
All right, okay. Excellent. Let's go on.
Now we're talking the side of tongue. They call the teeth mark. The tongue was bit by teeth. Okay, that means your tongue enlarged. What that means? Means you have insulin resistant people. Chinese people call it the indeficiency. Is insulin resistant. Insulin resistant people always linked to estrogen dominant. Insulin resistant, estrogen dominant, like the brother, sister, always by hand. Then if teeth mark, the side, this teeth mark strong like this, I always check the kidney. They already affect kidney. So I can easily just check the people's ankle, since they're swelling or not. If they're push the ankle swelling, then they come slowly back. That's kidney problem. Okay. Then you also can check your pee, cause any foaming bubbles or not. If you have a tiny foaming bubble with more than 30 seconds, they still hang there, means your urine protein. So this teeth mark means many things, or means after your digestion food, but the food don't go to the right place. So many reasons. So we need looking for that.
So that's another easy thing for people to look at is their urine, a measurement of how your kidneys are working. And what Dr. Chi is saying is that if you have bubbles in your urine for more than 30 seconds after you void, there's protein in the urine, and that protein is abnormal. Normally, your urine does not have bubbles in it or won't have bubbles after a few seconds. It'll just be a flat layer on the toilet. It'll just be that little pale yellow color, not have bubbles in it. And the bubbles can be pretty impressive if you got protein. So look for that. That's another sign of underlying disease.
Kidney function, herbs is much better. We have many people, GFR, really low. We bring it back. So herb doing the kidney is a very good result.
Excellent. All right, let's move on again, Dr. Chi.
Okay, we look in the underneath of the connected the line between gums and the upper lips. That's called the frenulum. They have a cyst of lumps there that relate to colon rectum condition. They can be either inflammation or can be polyps. So, and those area, if the doctor want you go to biopsy your colon, you better take an angiostat go together, because if they have polyps, it's a abnormal one, they can spread. So I mentioned any place, if the cracking tongue, the doctor say, oh, your bowel, your feces is a dark color, they will do endoscopy. Also, take an angiostat together, because we don't want to do anything, take the tissue, and it's cancer, they spread. So all the signs we can tell you early.
Excellent. So that little bump on that little piece of skin that goes from your lip to your upper gum, that's something too you can pull out, look in the mirror, and if you see a cyst or a bump on that little connecting skin from the gum to the upper lip, it's called the frenula or frenulum, that's indicative of colon or rectal conditions, and we've got some natural approaches for that to help improve that. And maybe it's a harbinger of a polyp or something in your colon that you should have further investigated. Talk to your doctor about that. Excellent stuff, Dr. Chi.
Spatial, the people, the nail, if you see the black line, that means internal bleeding. They either colon bleeding, either digestion tract, stomach or esophagus bleeding.
So a dark line on the nail, like a little vertical line under the skin or under the fingernail, and that can be any fingernail, can be indicative of bleeding in the gastrointestinal system. And then if you see this, and what Dr. Chi does, he puts all this stuff together. So if he sees the polyp or the bump on the frenula and sees a dark line on your nail, really keys you into whether or not there may be something significant going on in your digestive system.
Then many people nail have the vertical line, but the vertical line usually is your peripheral, the blood vessel, circulation not good. But once if the vertical line become a bumping, like a bead on string, that's either osteoporosis or osteoarthritis. Also, how do you tell is the osteoporosis or osteopenia? Then your nail will very thin, very thin. You can touch your tip of the nail, very thin. That's osteopenia, osteoporosis. Otherwise, it's osteoarthritis.
Excellent.
And you can use Chi. Use Chi, this product is excellent for improve your bone density.
Which product was that, Dr. Chi, again?
Use Chi. Use Chi.
Got it.
Use Chi for that.
Youth Chi, another great product to help strengthen your bones.
Make your T-score go up, and also make your bone strong, and also increase your muscle and make you younger.
Excellent. All right, let's move on to the next indicator.
Okay, look at under the tongue. Under tongue, you're looking for children, teenager. Under tongue is clean, don't see anything. But remember, this under tongue, the vein, if you see the blue vein or like this one, this is already big liver problem, because under tongue, the vein is connected to the portal vein from the liver. If liver pressure makes that, this is a liver cirrhosis patient. Okay, we don't need to see liver cirrhosis, but when we see this vein like a split, each side of the vein should be one vein. But if the vein starting branch, that's a liver problem. But getting like this one is very bad. Okay, so need a quickly prevention. Our liver Chi, excellent for that. Excellent for that.
Liver Chi, if you see those dark vessels underneath the tongue, would be helpful, and get that liver detoxification doing better. All right, Dr. Chi, let's go on to the next marker.
Liver Chi is not only detoxification, it's also very good for liver hepatitis C. If hepatitis C, hepatitis B, they all can do.
Sure.
Excellent. I would really suggest do that.
A lot of people.
This is the other one. You see, I mentioned the in the tongue, you only want to see one each vein. Okay, but you see this one is a 4 vein. Every vein is split. Can be liver cirrhosis or even liver cancer patient. So this is very good to see. We don't want to see more than 2 veins underneath of your the tongue. That's important to look at.
More than 2 veins, abnormal, increased chance of cirrhosis or liver cancer if there are 3 or 4 more veins, 3 or 4 or more veins under the tongue. Excellent, yes. Dr. Chi. Let's move on.
And also, you don't want to see any liver problem always after eat, bloating, special carbohydrate. And also, if your tongue taste bitter, dry mouth or bitter, you're also looking for the gallbladder. This time COVID affect to American, the most common cancer increase the most is the bile duct cancer, cholangiocarcinoma. They increase 700 times. All other cancer only increase 20%. But this one, 700 times, seven times. I see lots. And also, it's because P53 COVID patient, P53 gene, that is a cancer suppressive gene that mutate. So angiostatin can do that. And also, I wanted to know what is making the pancreas cancer. Number 1 is gallstone, tiny bile stone. So I suggest everybody, if you don't want to forget your breakfast, if you don't forget your breakfast, then your liver produces bile, accumulate the gallbladder, then gallstone will forming because they don't use. But this tiny gallstone, they're causing the gallbladder cancer, bile duct cancer, and also causes the pancreatic cancer. So I suggest people, even 1 egg in the morning, better don't eat anything. John?
Yes. What else have you got for us? Is that all we have today, Dr. Chi?
Yeah.
I think that's, we're coming upon the end of the show anyway. So let's just talk a little bit about if we have a listener who would like to learn more about what you're able to provide for them or happens to be near Anaheim, California, how can they get a hold of you and learn more about Dr. Chi and what you have to offer?
If you want a whole day class, November 22nd, whole day, I will teach in 11 to 12 hours. I will give out 800 slides to let the people to learn this one. Any professional or interested, you can come, Then otherwise, go to Dr. Wycoff. I give the short seminar and come to individually association. Yes. So,
yes, Dr. Chi will be back in East Lansing at Wycoff Wellness Center, 1226 Michigan Avenue in East Lansing, Michigan. He'll be here September 8th, 2025 to September 11th. You don't have to be a patient at Wycoff Wellness to see Dr. Chi. You can call and schedule your individual appointment. It's just $50. Dr. Chi will see people of any age, male or female. Also, Wycoff Wellness is the exclusive supplier of Dr. Chi products in mid-Michigan. You can pick up any of the Chi supplements we've talked about today by stopping by the office. You, again, do not have to be a patient to purchase our supplements, or you can give us a call. We're happy to ship them to you. And Dr. Chi, if someone wants to contact your office, are they able to purchase supplements through you, or do you just work with your cadre of physicians around the country?
I rather they go to you. You can also
excellent
advice. That's better.
So you go to wycoffwellness.com and learn more, or call us at 517-333-7270. And for those of you who hear the podcast before September 9th, Dr. Chi is going to be hosting with me at Wycoff Wellness in East Lansing a 2-hour seminar, 6 to 8 p.m. It's a free seminar. Everyone's invited. You don't have to be a patient to attend the seminar. You don't have to see Dr. Chi in the past, but it's a great seminar. We'll go into more detail about all the information Dr. Chi has talked about today and more. I would encourage you to call and confirm your seat. We have limited availability, limited seating. So call us at 517-333-7270, 333-7270, or 800-471-0255. Thank you, Dr. Chi, for being our guest today. I'm eager to see you again and your lovely wife, Cheryl, in a couple weeks. Thank you for joining us on...
Thank you, John. Always enjoy you come to see and your wife.
We're eager to see you. I'll have you hang on for just a moment. And this wraps up another session of Pathway to Wellness with Dr. John Wycoff. Keep listening. We have more exciting topics coming forward. Until next time, have a wonderful and blessed day.